Hello, my name is Mikael Nordfors, and this is the second lesson in my course in tendon attachment therapy. It's about how it works. A person who breaks his leg usually gets a plaster cast in order to stabilize the limb and keep the bones in the proper position during the healing process. A horse that damages the bone usually lifts the damaged leg and runs on 3 legs. The horse does this instinctively to avoid pain. I call this reaction the plaster cast reflex. The purpose of it is for the injured limb to be relieved from pressure and given time to heal. In nature, most chronic muscle tensions release when we move around and stretch. Our sedentary lifestyle, too much sitting, and work conditions with monotonous and repetitive muscle loads radically reduces the chance for this to happen. The plaster cast reflex makes the muscles in the injured area remaining chronically tense, leading to degeneration and weakness. For example, the thigh muscles in the case of knee and hip dysfunctions. The chronic muscle tensions makes the involved joint surfaces press against each other. Joint cartilage acts as shock absorbers and has no blood supply, but is nourished by synovial fluid, the fluid between the cartilages. When the joint surfaces never separate due to chronic tension, the cartilage begins to degenerate as a result of malnutrition and chronic overload. The dying cartilage is attacked by white blood cells, which in turn creates inflammation. The inflammation causes swelling and pain in the joint, which creates more muscle tension, which in turn creates more joint damage. A vicious circle emerges, and the final result is osteoarthritis. In each muscle, there is something called the Golgi tendon organs. Their job is to record muscle tension. When the Golgi tendon organs are stimulated by increased muscle tension, a signal to the muscle to relax will be sent by using autonomic nerve feedback from the spinal cord. You can see here. Here's the Golgi tendon organ, and the signal goes to the spinal cord, and then the relaxing impulse comes back to the muscle. By pressing the Golgi tendon organs of the involved muscles, you can relax muscles that have been tense for years. Another way to do this is to use stretching exercises. Chronically tense muscles get thinner, have less strength, and have also a decreased range of motion. Inside the muscle, bridges of connective tissue between the muscle fibers will appear, which reduces strength and mobility. In extremely chronically tight muscles, even calcifications can occur. The muscles become more and more transformed into tissue that cannot be influenced by our will any longer. Summary. Injuries and monotonous workloads create chronic muscle tensions, which gives rise to pain. The pain then gives rise to more muscle tension, etc. This vicious cycle can be transformed by 1. Applying pressure to the sore tendon attachments until the pain is gone. 2. Stretching exercises and exercising to relax and rebuild the degenerated muscles.